So today we are going to see cranium. It has got different view: norma frontalis, norma lateralis, norma basalis. But we'll see part by part, layer by layer. First, this part. This part is called as vault or calvarium. From outside, more preferred word is vault. From inside, preferred word is calvarium. But these two words are synonym. But while using these words, while we use vault, is more commonly preferred to the outer surface, and when we use calvarium, more commonly it is preferred to the inner surface. Now, as we know already that this vault or calvarium, it is made up of 5 layers. Those 5 layers are pericranium, outer table, dipole stand, lower table, and endocranium. These are the 5 layers. Vault is made up of squamous part of different skull bone. What are the squamous part? Squamous part of frontal bone. This much is squamous part of frontal bone. This much is squamous part of temporal bone. The whole of parietal bone is squamous, and there is squamous part of occipital bone. Now, what is squamous part? A flat part. Squamous means which have a very low thickness. You know, squamous cell epithelium. Okay. So, this squamous part of frontal bone, parietal bone, occipital bone, temporal bone, all these bones, frontal part forms this vault or calvarium. From outer surface, we will be able to see bregma, lambda, pterion and asterion. Pterion already I have said, Pterion, pterion, P is silent. So bregma, lambda, pterion, asterion. Up to the age of 2 years, it may remain soft, because as I have already told you, there is an upper table and lower table. This upper, between this upper and lower table, the calcification occurs. From parietal eminence, these are eminence, parietal eminence, here there are frontal eminence. From parietal eminence, calcification center to periphery occurs, and while at the last phase, these corners remains uncalcified. So these corners remains membranous, upper membrane and lower membrane, but no calcification. So that's why these corners remain soft. These are called as frontalis, that is bregma, lambda, pterion and asterion. Now, apart from this parietal eminence, frontal eminence, occipital protuberance, and here you will get some line that is called as temporal line. Superior temporal line, inferior temporal line. Very much similar to the line you have seen in the haircut of Virat Kohli. Superior temporal line and inferior temporal line. Now coming to the inside. Inside you will be able to see these arterial impressions. These arterial impressions are for middle meningeal artery. You will see 2 branch, anterior division and posterior division of middle meningeal artery, because arteries are pulsating, and while calcification occurs, initially it was soft, so the arteries maintain a hard impression on this parietal bone. To each impression, anterior division and posterior division of middle meningeal artery. Along this midline, you will be able to see attachment of falx cerebrum. Falx cerebrum, and here there is situation of superior sagittal sinus, and at the margins of the superior sagittal sinus you will be able to see some perforation. These are for emissary veins. These small perforations are for emissary veins. Okay. Now beneath that, here on this part, this continues at superior sagittal sinus and falx cerebrum attachment. Falx cerebrum, after that there is falx cerebellum, and this is the attachment of tentorium cerebelli, which is a roof on cerebellum. This is cerebellar fossa. Here cerebellum is situated, and here up to this is cerebellum. And dural fold covers cerebrum, then return back and form a roof on cerebellum, that is tentorium cerebelli. Now coming to this surface is called as cranial fossa. Cranial fossa is again divided into three parts: anterior cranial fossa, middle cranial fossa, and posterior cranial fossa, by a bone, that is sphenoid bone. In the middle, this is sphenoid bone. These are two wing, lesser wing and greater wing of sphenoid. Now anterior cranial fossa, it is made by the fold of frontal bone. The squamous part here turns inside and forms orbital place. This is orbit, and roof of the orbit is floor of the anterior cranial fossa. From this surface we will see roof of the orbit, and from this surface we are seeing floor of the anterior cranial fossa, and this plate is called as orbital plate of frontal bone. So plate is called as orbital plate of frontal bone. This is called as roof of orbit from this surface, and from this surface it is called as floor of anterior cranial fossa. Now two anterior cranial fossa joins together from both sides. This anterior cranial fossa joins together to hold a perpendicular plate like this, that is perpendicular plate of ethmoid bone. You can see here there is nasal septum is formed by that perpendicular plate, and due to that there is an elevation here that is called as crista galli. This elevation is called as crista galli. What is crista galli? That is the slot for perpendicular plate of ethmoid bone. ATM slot you have seen. From superior aspect there will be a slit, and from inferior aspect there will be a slit. So that slit, inferiorly there is a slit, due to that there is an elevation. Similar slit there will be on maxilla. तो नीचे मैक्सिला से अटैच हो रहा है और ऊपर ये क्रिस्टा गाली के नीचे, मतलब दो ऑर्बिटल प्लेट के बीच में ये ऐसा वर्टिकली अटैच हो जा रहा, क्या? परपेंडिकुलर प्लेट ऑफ ethmoid bone, and this elevation is called as crista galli. Now on either side of crista galli you will see some perforations. These perforations are for olfactory nerve perforation. Coming to the, here there is olfactory bulb. Like matchsticks, there are two olfactory nerve, and the anterior part there is a bulge that is called as olfactory bulb. माचिस की तीली के जैसा दिखता है. सामने जो बारूद का पार्ट है that is olfactory bulb, और जो stick है that is olfactory nerve situated on either side of crista galli, and this perforation connected to the nasal cavity. Here there is nasal cavity. Through that, this perforation on orbital plate, they come to the brain, and at the base of the brain, anterior most first cranial nerve. The nomenclature of cranial nerve are according to anterior superior to posterior inferior. So anterior most is first cranial nerve, that is olfactory nerve. So olfactory nerve here situated at the base of the brain, and these perforations going to collect the sensation. Now after that, here there is a perforation. You can see that perforation, if we follow this perforation, it will go to the orbit. So this is optic. This is for optic nerve. From both sides, that optic nerve come and forms a decussation here. Like this scissor, it forms a decussation here just above sphenoid, and this optic nerve comes out here on orbit. Here there was olfactory bulb which was smaller, but this optic bulb is larger, almost a size of a table tennis ball, that is your eyeball. So if someone asks, okay, which part of brain is visible? Optic bulb or eyeball. Your sclera or cornea is the dura mater, then choroid is the arachnoid mater, and retina is the pia mater. Okay, and this is optic nerve, and that optic nerve forms a decussation here, crisscross. Some fiber go to the same side, some fiber go to the opposite side, just above this sphenoidal rostrum, and that crisscross is called as optic chiasma. This is called as optic chiasma. So olfactory, then optic, and after optic, here there is a foramen. This is going to the again eyeball. So this is for what? Olfactory, optic, and then oculomotor. This is for oculomotor, and along with that there are muscles, extraocular muscles. So this is for extraocular muscles also. Here there are two fissures, superior orbital fissure and inferior orbital fissure, like greater than and lesser than sign. So this is from this inferior fissure, here coming out extraocular muscles, and this from this foramen there is oculomotor nerve. After oculomotor nerve there is trigeminal nerve. This is for trigeminal nerve, and after that there is trochlear. So the sequence is as per the name of cranial nerve: first, second, third, fourth, fifth. So during writing you don't have to mug up everything. You can just write it is originated behind n-1 and in front of n+1, like that. Now after that, this is anterior cranial fossa completed. We have already entered into the middle cranial fossa, which is between greater wing and lesser wing of sphenoid, and this is the sphenoidal rostrum. If we compare it with a butterfly, this is the thorax of the butterfly. These are two pairs of wings. Butterfly have two pairs of wings, greater wing and lesser wing. And from below you can see legs like structure. These two are medial pterygoid plate, and these two are lateral pterygoid plate. So two pair of legs like structure you see, medial pterygoid plate and lateral pterygoid plate. So what are the parts of sphenoid? Rostrum, lesser wing, greater wing, medial pterygoid plate, lateral pterygoid plate. Rostrum is 2 cm cube. From all dimension 2 cm, but at the middle 1.5 cm. So it is concavity on all aspect. Due to that concavity, at the center 1.5 cm, but corner to corner 2 cm. So it is a 2 cm cube, and within that, what is within the cube? Air, because it is a pneumatic bone. In skull we will see numerous pneumatic structures. Sphenoidal rostrum is pneumatic. There is frontal air sinus, there is maxillary air sinus. Okay. So sphenoidal rostrum, within that there is a ear sinus. Now this part just above the wing, this part which is separating the middle cranial fossa from posterior cranial fossa, here there is petrosal part of temporal bone. Petrosal part of temporal bone. Underneath that there is middle ear cavity and internal ear. This is external acoustic meatus where there is external ear. This is external ear, you can see this is external ear. From external ear, if you come inside, this is middle ear, this is the roof of middle ear cavity, and after that there is internal ear. So if you cut this, inside you will get 3 pairs of bone, 3 on right side and 3 on left side, malleus, incus, stapes, bone within bone. Within the petrosal part of temporal bone, you get malleus, incus, stapes on either side. Now this tent-like structure which is separating middle cranial fossa and posterior cranial fossa, this tent-like structure is called as tegmen tympani. Tegmen tympani means roof of the tympanic cavity. Tympanic cavity means middle ear cavity. So middle ear cavity ka chhad, that is tegmen tympani. Now after that there is posterior cranial fossa. Posterior cranial fossa mostly formed by occipital bone and partially by temporal bone. Now here we will be able to see a plus sign. Vertical one is for half for superior sagittal sinus continued here. What is falx cerebrum, and below that falx cerebelli, attachment of falx cerebrum and falx cerebelli. And the horizontal one is for tentorium cerebelli. Here there are 2 cerebellar hemisphere, small parts. This one is, these 2 are cerebellar hemisphere. This area is for cerebellum, and cerebellum is covered by a double fold of dura mater, that is called as tentorium cerebelli. So the vertically falx cerebrum, falx cerebellum, horizontally tentorium cerebelli, and beneath that there is superior sagittal sinus, transverse sinus, sigmoid sinus. All these structures are there. Okay. Now occipital bone have 3 parts. This part, this is foramen magnum. Anterior to the foramen magnum, this part is called as basilar part because it is from base of skull. So it is called as basilar part, getting attached to the sphenoid of rostrum. On either side, this part is called as condylar part because here there are occipital condyle. It is getting attached to the facets of atlas. First cervical vertebra, atlas, get attached here. So this part here there is condyle. So on either side of the foramen magnum, this part is called as condylar part, and behind the foramen magnum, this part is already, you know, this is called as squamous part. So 3 part of occipital bone: squamous part, condylar part and basilar part. On the contrary, temporal bone, this part is petrosal part. You know already this is squamous part, and this much part is called as mastoid part. Now again coming to the nerve, we have seen olfactory, optic, oculomotor, trigeminal, and uske after next 6th cranial nerve is abducens, that is for only lateral rectus muscle, that is also extraocular muscle. And after that facial nerve, don't penetrate it on midline. Facial nerve goes laterally and penetrate it just in front of mastoid process. Between styloid process and mastoid process there is a very tiny opening. This is called as facial canal. So facial canal is situated laterally. Most of the cranial nerve penetrating this almost near midline, but facial canal is laterally between mastoid process and styloid process. Here you can see on both sides there is facial canal. So this much for today. Next day we will see other part.